Hi, this is Dr. Tayani from the Tayani Institute, and today I'm going to introduce my colleague, Dr. Stephanie Mulick,
Hello.
who's one of our optometrists at our practice, and we're going to be talking about the before, day of, and after care of a pterygium surgery. As you know, pterygium surgery is a surgery that takes about 30 minutes to do, and it's outpatient. You basically come in, have the surgery, take off, and we're going to go over the details. So before surgery, if you're on any kind of blood thinner, we always like to have blood thinner stopped. If it's aspirin, 2 weeks prior to surgery. If it's Coumadin or warfarin or anything of that nature, it's usually 3 to 5 days before surgery. That's to help reduce any bleeding during surgery. And with pterygium surgery, unlike cataract surgery, we do encounter some blood vessels, so stopping the blood thinners is helpful. There's no medications to do before, unlike cataract surgery. We basically, the most important rule before surgery is not to eat or drink anything before midnight, which means if you're having surgery on Thursday, on Wednesday night, midnight, you would basically have your last meal or drink before midnight Wednesday, and then don't drink anything after. On the day of surgery, if you do take any blood pressure medications, we want you to take it with a little sip of water on the morning of surgery. All other medications can be held till afterwards. On the day of surgery, you arrive an hour before surgery to the surgery center where our nursing staff and anesthesiologists will meet you. You get an IV placed, you go through paperwork, some questions and all that stuff, and then you go into surgery. The anesthesiologist gives you some sedation, you're relaxed, and the edge is taken off, but you're not put to sleep. During surgery, we use a little local anesthetic to numb the area that we're working on, and it's a microscopic surgery. We take off the pterygium, do our procedure, use a graft. We've talked about that in the other video earlier. Once the surgery is completed, we do put a patch on the eye, which stays on for one night. And the next day, typically you're seeing either Dr. Mulick or one of my other colleagues. Dr. Mulick, what do you encounter when you see the patients on one-day post-op?
Usually one-day post-ops, the patients will feel a little irritation as well as notice some redness of the eyes. Other than that, usually people do really great with the surgery afterward.
Yeah, typically you don't need pain medicine, but it is something that maybe some extra strength Tylenol, or we don't like to use any of the anti-inflammatories because they actually are promoting bleeding as well. So avoid the Advils, the Motrins, aspirins. However, Tylenol is fine, and that's typically what we find is necessary, right?
That seems all they need.
In occasional cases, you might need a narcotic, but that's less common. We do recommend artificial tears after surgery, and there is a series of drops and ointment. Basically, we're going to go over that right now. An ointment is used at bedtime, which you put a little strip, about a 1/4 inch of an ointment on the eyeball right before you go to bed. That's the very last thing you do. And throughout the day, there are some drops that are usually a combination of anti-inflammatory, steroid, and antibiotic combination, and an anti-inflammatory. Those drops are used in various frequencies. Your surgery coordinator will go over that detail prior to surgery because every patient is a little bit different. Those drops are continued for a few weeks, and the other things to be cautious about is, first of all, there's no driving on the day of surgery, but you can drive the next day. And typically we tell patients to plan on taking about a week off of work because there is some discomfort, some aching during those first few days. What else do you recommend or encounter in the postoperative care for the first week or so?
No heavy lifting or bending, and no swimming.
Yeah, no swimming for about 3 weeks in the pool or ocean. So 3 weeks of avoiding that. You want to avoid shower for one day, 24 hours. After that, you can shower with the eyes closed. Water can run down from the back of your head. And again, the drops that are used and the artificial tears help with comfort. If you also have sunglasses, it will be helpful to use that in the first week or two after surgery because you might be a little bit light sensitive. As far as work, you can do things that you're comfortable with. You can use a computer, read if you're comfortable. There's no reason to stop that, but most people again are a little bit uncomfortable, so you want to minimize the amount of time you're on the computer. Well, again, Tayani from the Tayani Institute and Dr. Stephanie Mulick. Till next time.